I think over many years what we've wanted to do is to improve the care for Aboriginal people and also show that we are responsive to the needs of people from Aboriginal backgrounds. There's lots of different components to that. What we have had for many years is an Improving Care for Aboriginal People plan, which we develop for the Department of Health, and one of the aspects of that is over recent years we identified that what we wanted to do in formal meetings, say like opening of like the annual general meeting or education forums, to recognise Aboriginal people. So part of that is that we've developed a policy around acknowledgement of country. And so we are doing an acknowledgement of country in a number of meetings. And then there's also some functions like the NAIDOC week, where we have a welcome to country, and that's performed by a member of the Aboriginal community.
So thank you very much for coming, and I'll hand over to you, Debbie.
I'd just like to acknowledge that we're meeting on Jara country. Jara people are part of the Dja language group, and pay my respects to elders both past and present. And I'd just like to say I'd love to see everybody here today and how Bendigo Health is closing the health gap.
I'd just like to introduce our Executive Director of Psychiatric Services, Dr. Phil Tune. So Phil's here on behalf of John Mulder, our CEO today. Thank you, Phil.
Thanks, Robin. All right, look, I'd also like to formally welcome Jan Boynton, and one of the members of the Bendigo Health Board, who's currently here this morning, and members of the Department of Health, and respected elders of the community. So we're gathered here this morning to share a cuppa and some morning tea, but also to take a moment once again to recognise NAIDOC Week. At the same time that you're enjoying morning tea here, your workmates at other sites across Bendigo Health are also having morning tea at the same time, which is the first time we've attempted to do a simultaneous event across Bendigo Health, and hopefully not the last. NAIDOC Week is a celebration of Aboriginal and Torres Strait Islander culture and gives us an opportunity to recognise the history, cultures and achievements of Aboriginal Australians. It also gives us an opportunity to reflect on some of the progress Bendigo Health has been able to make towards closing the gap between Indigenous and non-Indigenous Australians, which is currently around 17 years. Through the commitment of the local community to work with us to move forward. In the past 12 months, we've seen the signing of the collaboration agreement between Bendigo Health and the Bendigo and District Aboriginal Co-op, BDAC, which provides a solid framework on which to progress many other initiatives. We've seen the display of Aboriginal artwork in the foyer and Aboriginal health promotion information around the hospital. We're particularly proud to be displaying artwork by Uncle Brian Nelson and also Margaret Moore, a young Indigenous artist. We've been able to achieve a project looking at the presentations that Aboriginal people have to our emergency department and how we might improve that part of our service to better meet their needs. We've seen the placement of Aboriginal flags at many front desks around the hospital and also the acknowledgement of country plaque at the front of the hospital. The theme of this year's NAIDOC Week is Change, the next step is ours. So over the next 12 months, Bendigo Health will continue to work with the community and other organisations such as BDAC to develop cultural competence training for our staff, to develop an employment strategy to increase our engagement with the Aboriginal workforce, and to continue progressing our plan to improve the care of Aboriginal patients. I'd like to thank the NAIDOC Organising Committee for their efforts in organising this event this morning, and particularly the effort that's gone into including all our remote sites.
It was probably about 18 months ago that John Mulder, our CEO, and myself met with the CEO of BDAC and also one of their senior managers. And what we recognised there is that we needed to have a really good foundation for the work that we were doing with the Aboriginal community. So we started investigating what that would mean, and part of that meant that we would have regular formal meetings together, and we now meet about once every 3 months, but also that we needed to have an agreement which detailed the responsibilities and the commitment between the two organisations. So that was where the idea initially of a partnership agreement, and then we decided that that would become a collaboration agreement, which I think shows a much more active approach between Bendigo Health and the local Aboriginal co-op. One of the things that has changed here has been the identification of people from Aboriginal backgrounds. And just over the past year, we've noticed an increase in the number of people that are identifying themselves as Aboriginal people. Why we feel that that is really important is that then we can look at, particularly when people are discharged from hospital, have we asked the question about whether they're from Aboriginal backgrounds? Do they then get referred to our Aboriginal hospital liaison officer? And then are they then supported as they go back into the community in all aspects of their health? There's a number of different initiatives that we do work with the Aboriginal community on. One of the initiatives that came out of the Closing the Gap work and that followed on from the work that we've been doing on the partnership agreement has been a forum which was between health workers from within Bendigo health workers from the Community Health Centre here in Bendigo and also the Aboriginal Co-op. It was also one of the other key participants has been the Primary Care Partnership, the Lot of Mallee Primary Care Partnership. The main aim of that forum was that we better understood each other's services. So we found out a lot about the services that BDAC offered, the Community Health Service offered, and we also shared about the services that we provide here at Bendigo Health. It's only then that you're able to make sure that people access the right health service at the right time. And one of the other opportunities that we have is when we plan towards our new hospital. At the last meeting that we had between the Aboriginal Co-op and ourselves, that was one of the key items for discussion. So we want to have the Aboriginal community involved in the design and the planning for the new hospital. We've already talked to them about some of the unique facilities that we're aiming on developing, so that will be another key area. We also have just recently acquired some artwork by a member of the Aboriginal community, and that's displayed in our main hospital foyer, and also notices encouraging people from Aboriginal background to identify themselves. We've also been providing education to our first point of access services, so like in the emergency department or to our ward clerks, so that they know how to ask the question of Aboriginal people as to whether they are from Aboriginal background, and that assists us in identifying and again being then able to refer on to the Aboriginal Health Liaison Officer. Just shows that we have a commitment to improving the health of Aboriginal people. That's in our local community, but also though I think within Australia that we are an organisation that has felt that it's really important to have that agreement and a real commitment to working together.